earlier, Dr. Asma, that this would have to be linked with other, agencies, departments. And I think what I would like to put on the table today is to see how we could link that with the current action plan that are currently being developed with the government for the next 5 years, especially with regard to child protection. When you talk about preventing suicide and giving a child a conducive environment, this basically, for example, leads to the fact that the Punjab government has is just working on a bill against child domestic labor, where they have allowed little girls above 15 to work, to be employed as child domestic workers, while we know that this is a worst form of child labor, while we know what they are experiencing in such environments. So I think if we already make sure that we really focus on ensuring a child protective structure and mechanism, so that children in the first place are not experiencing those forms of abuse and violence, this could be very helpful. And then I think if the mental health dimension is institutionalized within the response mechanism, and for example, referring to, I'm very much associated with, I'm saying I, but it means as a sample of so many other people and team, this mental health response is so much associated with, for example, justice reform. So there is currently a process to pilot further child courts or gender-based violence court, where you would give a more supportive environment for children to be able to safely and in a child-sensitive manner disclose what they have been through, not having to face secondary victimization again. We've seen little girls or young girls not coping with the court trial process and stop feeding themselves. I've seen cases like that where we literally were not able to save them because it was too much to bear. So for me, again, include what we are talking about into the interagency protocol that are currently being piloted at a federal level. It's in a design process, into the action plans for justice reform, into a forensic dimension. There is huge programs, to change the forensic chain of evidence. For example, mental health forensic expert for gender-based violence and for from what you call that pediatric perspective must be included into the training and the SOPs that are currently being developed. I think we also need to work on I like very much what you said, the duty bearers, the number of police officers or of judges who are facing depression and mental issues because of the workload, because of the, how confronting the cases are, what they are facing. This is also totally ignored, and that's something which is very much needed. And the reformative justice approach, which is again critical. Yes, it's terrible, and yes, we are with the victims. But then overall, if we think about what's going to happen for our society, do we put that abuser into an even more abusive situation, which means at the end of the day, you end up with a hardened criminal, dysfunctioning person with psychiatric issues who will not be able to function in a healthy manner, and so it's a kind of infernal cycle, one never-ending cycle. So thank you for saying that reformative and rehabilitative approach, I think, is crucial, and therefore you have a role to play at a preventive level while the trial or the investigation or the rehabilitative process is taking place within the structures where we're trying to solve that, which means the jail, as well as the hospitals, as well as the schools. And I think I'll finish also on that. The school, or the fact to ensure that children are not left in situations they should never be in the first place. And that's not only an issue of being poor or being, low or middle income countries. I mean, violence against children is an endemic issue. Okay, sexual violence against children is an endemic issue. We have choices to make. And we have to decide that we're going to pay someone in our home, an adult, the minimum wage we have to decide that we are going to work on family planning, so that as parents we take our responsibilities to protect, support, and listen to our children. And the caregivers within the medical field or within the schools or within the madrasas have to be there, have to be equipped, have to be trained to be there and to do that. The number of women who come to me and tell and disclose what they've been through as children, as you say, they never had anybody to talk to before, and this is destroying them. So I'm still very optimistic. It's just that we need to coordinate and organize ourselves at an interagency level.